with the broadcast. Still on health matters, with skyrocketing numbers of COVID-19 infections, concerns are rising over the capacity of counties in handling the situation. Reports of completely failed isolation facilities, insufficient personal protective equipment for healthcare workers, and the lack of proper medical care in counties have made headlines. Yet, with all these, Kenyans seem to have thrown caution to the wind, making efforts to flatten the curve even tougher. Ibrahim Karanja reports on the dire situation in the counties and the looming crisis.
At the War Memorial Hospital in Nakuru, healthcare workers are at a state of despair. Their isolation facilities are overstretched, yet more COVID-19 positive patients keep coming in.
We have isolated around 7 patients currently, and the wards are full. So sometimes we are forced to refer patients who require ventilatory support.
And to add insult to injury, the facility's intensive care unit caters for other general patients in need of its services, thus making care for critical cases a pipe dream.
Some who may require ICU support may need to be referred to other facilities who are able to take care of them in the ICU setup.
The situation here is easily replicated in many other facilities across the country, both public and private. Nakuru is one of the worst hit counties in the second surge. In Uasin Gishu and Kisumu counties, the Kimalel, MTRH and Kisumu County referral hospitals are full. In Kakamega County, offices will remain shut following a spike in the number of infections.
We have agreed to close down the headquarters here for 7 days. We will only have essential services.
And we in Ngao are really affected. As I said, it's really painful. This thing has hit us home. I have lost 2 of my favorite chiefs.
Yet, with no end in sight, the Ministry of Education insists that school will remain open, even with pocket cases of learners and teachers contracting COVID-19.
The second peak seems to be higher than the first one. Will there be a third peak or not? And if there is a third peak, do we still keep the children at home? And the answer is definitely no, because life must continue.
Now, I want to show you 2 contrasting situations in the same county about the risks of COVID-19. I am at Nakuru Nursing Home, one of the facilities that has been overstretched by the number of infections here. Yet right across the road here is the Matatu Termini on that other end, where caution has been thrown to the wind. The continued loss of lives due to the virus seems to have been overlooked not only by those in leadership positions but also citizens. Flouting of the containment measures is now the norm, and with heightened political activity, flattening of the second wave curve will not be a walk in the park. Ibrahim Karanja, KTN News.
Thank you, Ibrahim Karanja, for that. Now, just a reminder of our BQ tonight. We're asking you, what do you think is fueling the spread of coronavirus in the country? What do you think is fueling the spread of coronavirus in the country?
This coming in the backdrop of 1,185 confirmed cases in the last 24 hours. Feel free to interact with us. 22155 is the SMS line, or you can find us at KTN News KE, at Ashley Mazuri, at the Jesse Rogers, using the hashtag The Friday Briefing. Let's take a short break. We'll be back.